All right, welcome back. This is the end of our 3 out of 3 series. So thanks so much for sticking with me and asking questions and thinking about these things rhetorically because I really want to help make a difference for you. So what we covered was what are the problems that the dental professionals have, why are we having some of this pain, and now what can we do about it? So this is why we're here. But just remember, this isn't all encompassing. I just want to contribute to that discussion and give you a lot of really robust things to think about and to try for yourself. Like I said before, everyone's different. So we need to tailor an approach specifically to you to make a difference for your body, your experience like that. So we'll be going through some basic principles. I'll dive a little bit deeper about what pain is, and then we'll kind of slowly sprinkle in some things that you can do. I alluded to it before. So what are some big things that we can do? The lowest hanging fruit that you can do now is clean up some of your wellness discrepancies. So, like I said before, wellness, we're thinking about just generally and globally about your body, your sleep. Are you getting enough sleep? That's when we recover. That's when we rejuvenate, we rebuild. And if you're not getting enough sleep or enough good sleep at the very least, your body's recovery is dimmed. It's stunted. So then you're having to do all those work demands again at a slightly less capacity. And if you're consistent with your sleep, it'll just wear down on you and your body will slow itself down recovering when we need it to boom. I need to recover as quickly as possible so I can get after it again. So get enough sleep, 7 to 8 hours if you can. Some people need more, some people need less, but figure out what feels best to you. How do you feel when you get a bad night's sleep versus good night's sleep? Is your mind more clear? Are you less groggy? Are you in a better mood? So figure out what's your number. So for me, my number is 7. 8 hours, I'm kind of groggy. 6 hours, I'm groggy and tired pretty quickly by the middle and end of the day. And I don't want to lean on any coffee or an excessive amounts of caffeine to keep myself up. That just doesn't work for me. Okay, nutrition was the next big low hanging fruit. Or do you have any goals? Are you at the weight that you want to be? And weight is deceptive. You could have a big amount of lean body mass, but then society tells you that, oh, you're overweight. No, no, this is all kind of specific to our bodies. Where do you want to be? Where do you feel the best at, athletic wise, function wise, doing your job, or hanging out with your family wise? Are you counting your calories? Do you know how many carbohydrates, proteins, and fats you're eating in a day? Do you feel like this is affecting your overall health? Have you been told you have high cholesterol, or are you pre-diabetic? What's your A1C? Stuff like that. And this is stuff that we kind of advocate to our patients for. Okay, manage these things and watch out for them. But do the professionals do that themselves? I have to say that most professionals are always the hardest patients to have when trying to help themselves. And I attest to that myself too. I'm so willing to bend over backwards that sometimes I forget to help myself out. And I need to make it clear that my health, your health, is your priority. How can you help other people, your clients, your family, uh, if your body is not being taken care of and your body is slowly getting worse and worse? So, whether it's prevention, I don't have any pain, but I want to prevent it from happening. These are really solid things to clean up if they're not already pretty good for you. So, sleep. Are you getting enough? Nutrition. How's your nutrition? Are you maintaining weight? Are you at where you want to be? Are your energy levels good? Stress, anxiety, depressive type symptoms. So, physical therapists don't deal with the psychological stuff, but we can give you basic wellness ideas to try to help out with that. So, we really want to manage your stress levels, your anxiety levels. Um, and since I'm talking to you all, my biggest thing is in the clinic right now. I can give you some pointers about at home, and some of these kind of help out with both. But what I really, really want to talk about, how do we modify these things? I don't want people to just think that taking a pill, if they're having a lot of anxiety, if they're having a lot of stress, or even a panic attack, oh boy, I don't wish that on anybody. I don't want it to be normal to think that they have to take a pill. Is there something we could do about that to prevent it from even happening? Is there something that we can do to help modify it when it is happening? Now, just basically speaking, wellness wise, we'll just talk about breathing. Breathing's your number one way of really short term and over time helping out with your stress levels. So, how can you do that? Well, we can actually lower our heart rate and lower our respiratory rate, our breathing rate, and even lower our blood pressure just by taking a few nice deep breaths. So, in through the nose, nice exhale through the mouth. So, I always say in through the nose, blowing out the candles afterwards. If you're feeling the stress creeping up, or if you got a smartwatch and your heart rate's getting over 100 at work, you have a tough patient, or your boss is chewing you out, or you're not going to be making the productivity throughout your day. Take 2 or 3 consecutive deep breaths. Try that every few hours, every 2 or 3 hours. That will help kind of set everything and lower it back to where a baseline homeostasis should be. Normal heart rate, hopefully, you guys are aware of this. 60 to 90, 99 is within normal range, but once we get over that 100, it might be a little bit too much for you, and below it might be a little bit too little. So make sure and talk to your doctor about that if you're concerned. So breathing, um, one thing that I can't stress enough is be strategic and communicate your needs, not only at home but at work. These little things that aggravate you, little assumptions that they're always wrong, I feel like. Don't get me on assumptions, please. It's not good to assume. It's always good to clarify and ask clarifying questions. Okay, is this how you really want it? Is this okay? Because if you just assume, or if you don't communicate your needs, it's just going to build up. And if we don't get that out, the stress builds up in our body. Our blood pressure rises, our heart rate rises. We start to breathe heavier. We're a little bit more short. So breathing can help out with that, but you just got to express your needs. Do it strategically. You don't have to be rude about it, but I also want you to advocate for yourself. Don't get all walked over. Really challenge people. Is this normal? Is this feasible? Is there anything we can do to work with each other to meet in the middle, kind of thing? The last one I have for you is, remember to set time aside for yourself. This could be to figure out nutrition, your macros. This could be to try and go to bed a little bit earlier. This could be to make time to hang out with your friends, your family, do something fun. When we have fun, when we laugh, we kind of get rid of some of that stress and anxiety. We forget about our troubles, and we kind of shed it some. Now it may come back, but we want to try and manage the stress, but then maximize how much we can have fun, how much we enjoy our life. So if there's some hobbies that you haven't gotten to in a while because of this or that, see if you can slowly get back to it. I don't say just jump right back into it, because your body might not be able to handle it. Your time schedule might need tweaking, stuff like that. But try and figure it out. Get your mindset on, what can I do every day for myself? How can I help myself out to really spread my passion and what I really want to do in life, which is hopefully help out people's teeth, educate them, be excited, smile for them, make them laugh, come up with a funny joke for them. That all takes energy. And if we're bogged down with some of these things like pain, anxiety, stress, you're hungry, you haven't eaten, stuff like that, lack of sleep, it can really affect that. So now we'll get to the good stuff. I'll put it in 3 simple words. Movement is medicine. So this is kind of the secret sauce. I can just call it done, all done with the lecture. But no, I'll get into it a little bit more. But the hard part is before I get to the movement part, which I'm the movement expert, physical therapy. One of the best things we can do is educate people about pain. So this is me educating you. Research shows that knowing more about your pain can significantly help decrease it if you only just learned about it. Mic drop. Who would have thought? This is what I do on a daily basis. And hopefully you guys know a little bit about pain neuroscience as well. We don't prescribe anything, but boy, we know about the neuroscience of it and how we can affect it by talking about it. We're essentially pain experts without prescribing anything other than movement, because we're conservative practitioners. So, what is pain? I asked you guys this earlier, but now I'm going to give you a definition. I'm going to read off of my notes right here. So, from the National Institute of Neurological Disorders and Strokes, they say pain is an unpleasant sensory and emotional experience. No two people feel pain the same way, even if the reasons are the same for the pain. Pain is highly personal experience, and it's a person's report of their own pain is the best measure. So this is why we need to do a really good subjective interview with our patients to really get after what do they think is the cause of it, how do they describe it, what do they feel about it, and go from there. So and like I was saying before, it's not literal tissue damage, but more of an experience. It's associated with the actual or potential cause of tissue damage. So it doesn't necessarily have to be tissue damage. That's really what I wanted to hammer into you. One other thing is that the brain can really modify also how we interpret pain. So this is where I kind of come in with the pain neuroscience. Educating you is shaping your beliefs about your pain. So the pain is, it can really ramp up or down. It's kind of like an alarm system on a car. You have to hit the car to get the alarm going at a certain rate. How hard we hit it and when it makes that alarm is our baseline sensors of makes the alarm, that signals pain. Boom, 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 that hurts. Now, what happens if I raise the bar to that pain threshold? Well, now I have to hit the car harder to make that alarm. Now I have to have more tissue disturbance to even classify as pain. This is how we can build resilience. Well, now the brain can do the opposite. So now what happens is we lower the threshold. This is with pain being turned on by a nice gentle touch. It could be gentle pressure. It could be moving your body in a certain way, and its signals go off. Ouch, ouch, pain, danger, danger. Now, should that hurt? Is that appropriate pain? No. But it feels like it. It might feel like I'm sticking a hot poker in you, but clearly there's no blood, there's no scratch, nothing. Why? The brain can modulate how we feel that pain. But the reason why I started with this part is because when we're down here and the threshold is low and everything hurts and it gets aggravated and it's hard to make it feel better, I'm telling you, we can change your threshold. We have neuroplasticity in the brain, not only for movement, but also pain and different experiences. So I'm going to let that sink in. This is huge. This is how physical therapists can help you with your pain. We have other ways of treating that and showing you how to do that at home. Physical therapists aren't responsible for all treatment. We teach our patients to do their home exercises and we modify it based on what the patient says. So this is the treatment for pain. That's my biggest point. It's not just a checkbox that I have to sign off on. This isn't just or this isn't a diagnostic code to get reimbursement. This is the actual thing that gets after parts of those root causes of pain. So this is just huge. I can't not specify this enough. This is it. It may not seem like it, but it is. So that's the cool part. And hopefully I can change your beliefs about pain if they're kind of out there. Now that we talked about that, this will kind of help shift your mindset about pain. We'll just say if I have a lot of pain and anything I do makes it worse, you can't tell me about it. So some of this education will try and unwire those pre-existing misconceptions. Now we'll slowly start to give you that confidence to even start moving. Some people don't even want to move. My back is out. It's going to slip again. It's going to do damage. It's going to break, snap, all those bad words. Those bad words can have compounding effects to really lower that threshold for pain. But showing your body that it can do things will increase that threshold. So that's what we'll do. So the next thing that we're going to talk about is the movement aspects of it. So we're going to try and rebuild that resistance and the resiliency to movements. So resistance is I can't move my body. My body's deconditioned. It gets tired. It hurts after just doing a very little. Well, that's inappropriate. We want to try and slowly, unfortunately, it's slow, but we're going to slowly build that up. So we're not going to just give you a ton of things to do. And then boom, the next day you're so sore. You're cursing my name. You're like, I'm never going back to that guy. He has no idea what he's doing. No, we got to start out slow, almost so slow that you're like, are we even doing anything? This is dumb. Like, this is totally not worth my time. Well, come back to me tomorrow and let me know how you feel. Even though we do a small amount, you could be like, whoa, doc, I was so sore from that and I had no idea I would be. Or you could say, oh yeah, it was nothing. I knew I wouldn't be in any pain. This is easy. Great. Now we'll progress it. Then we'll progress it. Then we'll progress it. Stuff like that. So we have all of these small wins to really build up that resiliency. So another way that we can really help out is managing how much movement you have at work. So this is important. We just got done saying there's a lot of sustained postures, there's a lot of repetitive movements. What are you talking about? So what I want to say is we want to teach you all how to do micro movements or micro breaks throughout your day. So you can't tell me that you have no time at work. Like that's just ridiculous. What are you doing from when you get done doing a technique with a patient and you're grabbing another instrument? Well, that's time. You can say, oh, I'm just going to do something real quick. Okay, get back to it. That took 2 seconds. Oh, I have to go to the restroom. So now I can move my body a little bit. Oh, it's in between patients. We're at a lunch break. You see where I'm going with this? So we can always make time, even if it's for 2 seconds. The more we can get the body moving, the more blood flow we're getting, the faster we can recover from our sustained postures and our work demands. It may not seem like a lot, but that stuff can build up, especially if you're doing procedures that take hours on end, or if you're just nonstop rapid fire from one patient to the next. They're not going to mind if you take 2 seconds to just throw out your arms a little bit or lean to the side or twist while you're chatting with them, building that rapport. That's just easy to do, but it takes time to build into your routine. That's what I'm here for. So we also look at what activities are you doing right now? Anywhere from sedentary to, oh yeah, I'm a CrossFitter. I go to yoga. I play weekend volleyball in the sand. Great, cool. How are you feeling with that? How's everything going with that? Do you get a lot of injuries? Do you stay pretty good? How much do you train for it? Stuff like that. So we kind of see what's your work routine, what's your workout routine, how are your activities? And that's based on that. That's where we start. There's no judgment whatsoever. Just because somebody does CrossFit and has neck pain and we start at a slightly higher level doesn't mean that's any better for the person that's sedentary that starts really, really low level. Everybody's different. We got to treat them different. And if there was a cookie cutter approach, we wouldn't be doctors. That's just ridiculous. Everybody gets a specific tailor-made and evaluated plan of care. That's just what the doctoring profession does. And that's what the high expectations are of being a professional. So the magic sauce is not only education, but also we're going to put with strategic, purposeful overloading of your tissues. So you're in pain or want to prevent pain, figure out where you're at, then we're going to, boom, progressively overload it. Your body gets used to that. Boom, progressively overload it. Oh, we overextended it. We worked you out too much. Oh, you went down. You're really sore. You're in more pain. Okay, we break it back down. So everybody's different. Health and wellness is not a linear approach. We're going to be having some ups and downs, but as long as our general trajectory is up, that's where it's at. I have to be able to listen to you. I have to be able to communicate effectively. Just by doing the same exercises won't help you out. We have to progressively make it harder, even though you may do a lot or a little at home or for hobbies outside of work like that. So that's it. That's the biggest things that you can consider. So now where I come in, this is the third piece of the puzzle. I hold you accountable. Because honestly speaking, and like I said before, the professionals are the worst at doing stuff that they need to do to help out their bodies. Where do we start? How do we do that? I don't know how to organize myself, or other people are on the other aspect. I have a calendar, I have a to-do list, I have all these things. My glass is full. I don't have time. Well, is there anything we can kind of move around, switch aside, do at a time, delegate, ask for help from other people or family members, front office or assisted personnel? Is there anything we can delegate to? So that's how we can come up with strategies on how to hold you accountable and create that routine so you can consistently build up that progressive overload. And your reward for all that, for doing it for time, weeks and months, and hopefully years, is resiliency. That just means how strong your body is to be able to resist injury and dysfunction. So like I said before, your sustained postures, you got to do what you got to do. Can your body recover at a faster rate than what you do to your body at work? It may not seem like much, but if we're not moving our body, we're not getting blood flow, we're not getting the nutrients, we're not getting the trash out, we're not recovering. Now, if we are moving, we can periodically speed up that and over the grand scheme of things, reset our body. Okay, I'm at such a capacity to do work without hurting my body that when I do my stuff, I work out, I have fun, I sleep, I eat well, I'm hydrated. The next morning, it's back to normal, and I can do it all over again. I'm not overly sore. I'm not in a lot of pain. I'm not super stressed or anxious about it, because if you don't feel it, if you feel good, you shouldn't technically be thinking about it. So bring it back down and kind of review what we talked about. We figured out where you're at, activity level wise. We're starting light, progressively overloading you, building your body up. And number three, you're not going to like this. It's going to take longer than you think. That's just how it is. That's histology. That's how tissues react. That's just all of our physiology. Now, there's a lot of gimmicks out there that tell you, okay, get ripped in 30 days, do this in 7 days, stuff like that. It takes a lot longer than that. I'm here to tell you, and everybody's different. It just depends on your genetics, how your wellness is, all that stuff. But just as a blanket statement, it is going to take weeks and months to get this. And on top of that, you have to be consistent. It's not going to work if you're not consistent or only doing it once a week. No, it'll help, but it's not going to be optimal in really, really making those changes that you're hoping for. And that's part of my job, is to show you the data. Say, this, you're doing great, Dr. Jones. You've done 4 workouts out of 5 this week, and you've consistently held that average for 6 weeks. Is there any wonder why you have less neck pain when you're in the operatory? I'm not surprised. That's a good thing. You're doing awesome. Like, and we're teaching you lifelong skills that once you're done with me, you're going to hold on to those skills and that knowledge for the rest of your life. I couldn't be happier. And then you might have somebody maybe do one exercise or one workout a week, and they're just not following the program. They're not consistent. Their pain might get better, because of all the other things we might have helped out with, but they just weren't super compliant with the program and helping at all these different facets. Great. I mean, hopefully when you can commit more to yourself and do a little bit more for your body and stick with a plan, test how your pain is and where it is 6 weeks, and set goals for yourself. That's also what I'm here for, but it's definitely not optimal. I am here to make you as successful as possible and to teach you these things. I don't want you to be part of my program for the rest of your life. I'm here for you, but that's not ethically what I want to do. I want to give you the tools, get you better, show you that it works, and then set you free. Here's are the principles that your body needs to help you with your quality of life, with your work life, productivity, less accidents, more procedure successes, stuff like that. Those are objective measures that we can test and show improvement on, and then you take it from there, kind of thing. So this is me not sugarcoating it. I'm not trying to stroke egos. This is my passion, and I'm here for you. So if you have any other questions, let me know. I'm here for you. This is my 3 out of 3 part series. I evaluate all my dental patients. I can do them at your clinic, or you can come to my office in Tempe. We'll take the measurements. We'll get you going on a plan. We'll set you up on an online program, and I'll set things up every day for you. And I'll also put little catch up days in there too. Oh man, it was such a busy week. I didn't have time. Great. I set some days in there to catch up. I'll hold you accountable. There's a checklist. All you got to do is press the complete button, and boom, it gives you credit for the workout that you did. And now I have data to show that you are giving this a shot. I expect you to really have some good success with this program in 6, 8, 12 weeks. I mean, probably a lot sooner than that, but we want to continue to build that resiliency within the program and then show you how to do it in the future. So if you have any questions at all, I'm here for you. This is what I want in life. I want to help you. I'm here for you. Let me know, comment, reach out to me, and hopefully I can meet you in the future. All right, guys, thanks for sticking with me. It means a lot to me, and have a wonderful rest of your day.